Let's dive into this week's top stories. The FBI is warning about the HiatusRAT campaign, a series of cyber attacks that uses a remote access Trojan to infiltrate devices. The attacks originally targeted outdated network devices, including a U.S. government server handling defense contracts. Attackers recently shifted their focus to lot devices in the U.S., Canada, Australia, New Zealand, and the U.K., and are exploiting unpatched vulnerabilities in these Xiaomi and Hikvision web cameras and video recorders. The FBI urges organizations to patch vulnerabilities, disable telnet access, and keep a close eye out for any suspicious activity. Amergis Healthcare staffing is notifying more than 11,300 people of a February data breach. Someone hacked into its email system, exposing names and other personal information. Amergis has since secured its system, beefed up its cybersecurity, and is offering free credit monitoring to affected people. The company says so far there is no evidence the data has been misused. Richmond University Medical Center has notified the Maine Attorney General and patients of a May cyber attack. The breach may have exposed names and potentially social security numbers. The exact number of people affected remains unclear. RUMC's electronic health record system was not affected, but other files may have been accessed. RUMC says there's no evidence of fraud or identity theft at this time. Brockton Neighborhood Health Center reports a data breach after detecting unauthorized access to its network in early November. The breach exposed patient information, including names, medical and insurance information, and more. Affected patients should monitor their credit and insurance statements for any unusual activity. BNHC says it's reviewing its policies to prevent future incidents and says it's committed to protecting patient data. Ireland's Data Protection Commission fines Meta €251 million for a 2018 Facebook data breach. It exposed the personal information from 29 million accounts, including 3 million in the EU. Hackers exploited Facebook's View As feature to access sensitive user data like names, emails, phone numbers, and more. The DPC cited Meta for multiple violations, including failing to notify authorities, poor documentation, design flaws, and collecting unnecessary data. Meta plans to appeal the decision. Healthcare giant Ascension is hit with a cyber attack exposing the personal and medical information of nearly 5.6 million people. The breach was caused by an employee accidentally downloading a malicious file, giving attackers access to Ascension's systems. The attack exposed medical, credit card, and bank account info and social security numbers. Ascension began notifying affected people on December 19 and is offering free credit monitoring and identity theft recovery services, as well as insurance reimbursement for related losses. The Texas Attorney General settles with Pieces Technology for misleading claims about its AI accuracy. The company, which uses AI to assist hospitals, claimed its tools had a critical hallucination rate below 0.001%, but the AG said those claims were deceptive. Pieces denies any wrongdoing, but has agreed to define and explain its AI accuracy metrics, disclose potential risks of its products, and avoid misleading advertising. The case highlights the growing scrutiny of AI claims as regulators demand greater transparency and accountability. The University of Texas Southwestern Medical Center is hit with its third data breach of the year. The latest breach impacted the personal health information of about 43,000 patients. It happened when a third-party calendar management app used by employees accidentally gave the vendor access to calendars containing PHI. The exposed information included names, birth dates, medical record numbers, diagnoses, lab test data, and incomplete social security numbers. The medical center does not believe the information has been misused at this time. A Texas judge temporarily blocks a Biden administration rule aimed at protecting the privacy of patients seeking abortions and gender-affirming care. The rule prevents sharing patient information about legal abortions with state authorities enforcing abortion-related penalties. Those against the rule argued it conflicted with Texas laws and hindered mandatory reporting of coerced abortions or minors receiving gender care, and the judge agreed. The decision highlights tensions between federal privacy protections and state restrictions post-Roe v. Wade. It could shape future policies on healthcare privacy and access. New numbers show data breaches in 2024 affected about 168 million people and involved about 500 or more records. The 10 largest breaches accounted for nearly 137 million compromised records. According to the OCR data breach portal, 90% of major breaches were caused by hacking and IT incidents. The three biggest breaches of 2024 included Change Healthcare, Kaiser Permanente, and Health Equity, which exposed 4.3 million records. The Office for Civil Rights will focus its 2024-25 audits on ransomware and hacking prevention due to the rise in cyber attacks on the healthcare industry. The audits aim to check whether organizations are following HIPAA rules, spot risks before breaches happen, and highlight effective security measures. The OCR plans to audit 50 organizations and then release a report to help the industry strengthen defenses against cyber threats. Organizations should prepare for the audits by reviewing compliance programs, updating documentation, training staff, and conducting internal security checks. The audits typically last weeks. The U.S. Department of Health and Human Services Office for Civil Rights proposes changes to HIPAA security rule to better protect electronic health information. Major changes include removing the distinction between required and addressable specifications, requiring encryption for electronic PHI when both at rest and in transit, requiring multi-factor authentication to access ePHI, and implementing annual compliance audits. They want to hear feedback on the proposed changes. You can do so over the next 60 days by visiting regulations.gov. A new report shows ransomware attacks are causing delays in care, complications, and even patient deaths. The report from the Ponemon Institute and Proofpoint found 20% of hospitals hit by ransomware reported an increase in patient deaths. 57% said the attacks delayed procedures, and that hospitals face nearly one cyber attack per week. The report highlights how cybersecurity is a life or death matter, and hospitals must treat it as a top priority to safeguard patient care.